Is diabetes an incurable disease, type 2 diabetes? Should it get worse all the time as it usually does, or is that a symptom? Is that because we're treating it totally wrong or not even treating it at all? That's what I'm going to talk about with my guest today. I'm here with Dr. Jason Fung, a nephrologist from Canada. Welcome.
Oh, thanks very much.
So I just watched a presentation by you. I thought it was really fantastic.
Thank you.
It was about how we treat diabetics today in the medical system. And you are a nephrologist. You meet diabetics when they've had their disease for a long time and they're really sick, right?
Yeah, so I treat people on dialysis. That's a lot of what I do. And it's very disheartening because what happens is that when they develop their disease, they're so sick. But the diabetes itself is actually quite reversible. And that's one of the things that I realized a short while ago. And that's what needs to be understood, is that this is not a disease that needs to progress. But we often tell people that it's a chronic progressive disease. And that's not simply me talking, but if you go to the diabetes associations, whether it's the American Diabetes Association or the Diabetes Australia, they all put out there that this is a chronic disease. And they tell people essentially that you have diabetes, you'll have it for the rest of your life, you might as well get used to it. But the problem is that that's simply not true. And it's actually pretty easy to prove it, because if somebody came up to me and said, I've had diabetes, I was told I had diabetes, I watched my diet, I lost 50 pounds, I cut my carbs, I cut my sugar, and now they took me off of my medication, I'm fine now. That's obviously true. Nobody would say, oh, you're lying, right? So that patient who has lost the weight, who has changed their diet, has increased their exercise, for instance, their diabetes actually got better. And the thing is that if that patient got better, what happens to this idea that this is a chronic progressive disease? Well, obviously it's not true. Because any time that happens, every time it happens, it means that the disease is actually reversible. But you have to know how to reverse it. If you don't know how to reverse it, then you're just going to get worse. And the thing is that the drugs don't actually do anything for the disease. And this is also not controversial, because the thing is that type 2 diabetes is a disease of too much insulin resistance. And that's not controversial. Everybody acknowledges that, right? So if you have very high insulin resistance, it's going to cause high blood sugar, right? But that's the symptom of the disease. The disease is actually too much insulin resistance. So the treatments that we give are all targeted at blood sugar. Right? That doesn't make any sense, because it's almost like, to give an analogy, if you have an infection, if you have a leg infection, well, you need to treat that infection. So what was causing it was bacteria. You give antibiotics. But that infection can give you a fever, but that fever is not the disease. If you start treating that fever as if it is the disease, then that leg wound is going to fester, because you're treating the symptoms of the disease and ignoring the disease. But that's what we've done with type 2 diabetes. We're treating the blood sugar, but it's not a disease of the blood sugar. It's a disease of too much insulin resistance. So what happens is that because we're not treating the disease tends to progress. So if you look at what happens over a period of 10 years, 15 years, what happens is that you start off with one medication, then you take 2 medications, then 3, then you take insulin, then more insulin, and more insulin. And after 10 years, you started with one medication, now you're on 100 units of insulin a day. Well, you're taking more medication to do the same job, to keep that blood sugar the same. That means your diabetes is worse. Even if your blood sugar is better, your diabetes is worse than it's ever been, because you've never actually done anything about treating the insulin resistance. So that patient who went and lost weight and exercised and cut out the carbs and cut out the sugars, they actually reversed their insulin resistance, and therefore their sugars came down, which is far different than making your blood sugars go down by force, by medication, and ignoring the actual disease. So that's the fundamental mistake that we've made over this last 20, 30, 40 years, right? We've treated the disease of type 2 diabetes, which is too much insulin, as if it was type 1 diabetes, which is too little insulin. So you got to understand that type 1 diabetes has too little insulin. So that makes sense. You should give them insulin. Type 2 diabetes is too much insulin. You need to reduce their insulin. But instead, we're giving more insulin to a disease state that has too much insulin. Well, of course, that's not going to work. That's crazy.
And you had an analogy there as well in your talk. You were saying it's like, that would be like treating an alcoholic with...
Exactly. So if you have a disease such as alcoholism, where it is characterized by too much alcohol, the very last thing you want to do is give more alcohol. And that seems very obvious, right? But if you look in the short term, as you take away the alcohol, they might get the shakes, they might get delirium tremens. If you give them alcohol, they will feel better in the short term, right? But that doesn't mean you're going to make the alcoholism better, right? That's the real problem, is the alcoholism. You can't treat the short-term thing at the expense of the long-term. What we've done is treat the short-term. We said, wow, your blood sugar is high, let me get it down, right? But it's like, well, what's happening to the disease? Who cares what's happening to the blood sugar? What's happening to the disease? It continues to get worse. So it's just like that alcohol. Too much alcohol. The disease is too much alcohol. The cure cannot be to give more alcohol.
Right. So to be clear, giving insulin to
the
a common type 2 diabetic is like giving alcohol to an alcoholic.
Exactly. So the disease is too much. It's insane. In fact, it's not simply that it's not treating it. It's going to actually make it worse, just like giving that alcohol. You have a disease which is characterized by too much insulin. You're giving more insulin. You're not making it better. You're actually making it worse.
So the patient will gain weight and their insulin resistance will get worse.
Exactly.
Yeah.
And the funny part is that the patients all know this, because this is what happens. And I talk to a lot of patients, and they say, they go to their doctor, they start insulin, then they gain 15 pounds, 20 pounds, right? Which is, we all know that happens. That's not a secret, because insulin is what really drives weight gain. So what happens is that they take the insulin, they gain weight, and they go back to the doctor and say, Doc, what's this? You tell me I need to lose weight to get better. Then you go and give me a medication that makes me gain 20 pounds. This is not good. And the doctor always says something like, well, what are you going to do? You need to take the insulin, go exercise, right? But the problem is that it was not the lack of exercise that made them gain weight. It was the insulin that made them gain weight. So you need to treat that. You need to reduce it.
So what do you do? What do you do if you're a type 2 diabetic?
Well, the thing is that it's a dietary disease, right? And if you're a type 2 diabetic, it's a dietary disease. It's a disease of essentially too much sugar. So if you understand it like that, then the answer is to get that sugar out, get it down. So the first thing you need to do is cut out all the sugar, cut out a lot of these refined carbohydrates, which are just sugar. So the breads and the pastas, right? So they're all chains of sugar. That's all carbohydrates are, chains of sugar. As you eat them, they get broken down into sugar. So if you have too much sugar, if diabetes is essentially too much sugar, you got to stop taking sugar. Otherwise, you're going to make it worse. So that's probably the first thing. You can do more exercise, try and burn it off. And the other thing that you can do is try to do something more extreme, such as fasting, for instance. You can actually
more extreme than a strict low-carb diet. I love it. Okay, fasting. Tell me more about it.
So fasting is actually the most efficient and the most effective way to lower insulin. There's really no drug that does it. There are actually two, but they're not very effective to lower insulin. But if you understand that the disease is too much sugar, too much insulin, then you got to say, well, if it's too much sugar, too much insulin, let's get rid of the sugar, let's get the insulin down. How am I going to do that, right? So the thing about the sugar, you can go on a very low-carb diet, a ketogenic diet, and that will get your sugars down. But it doesn't necessarily get your insulin down, because the proteins and the fats still raise insulin. Not to the same degree that carbohydrates do, but they still raise insulin. So you can get that sugar down, but you won't get that insulin down. So you can actually put people on various periods of fasting, because you're not taking anything. It's not simply low carb, it's low protein and low fat, right? It's nothing at all. So think about what's going to happen here. The body is not going to have anything coming in. So what it's going to happen is it's going to start burning that sugar. And that's perfect. That's exactly what we want it to do. It starts burning sugar, burning sugar. After it burns the sugars, your sugars come down. You don't have to take medications. You don't have to take insulin. After that, it starts burning fat. And that's perfect. That's exactly what we want to do. And there's always two questions that come up when you talk about fasting. One, can I do it? And the thing is, you have to understand is that literally billions of people around the world fast on a regular basis through their entire lives, right? So the Muslims, the Hindus, the Buddhists, the Catholics, almost every major religion in the world prescribes fasting. Not because it's super harmful, because it's very beneficial. And what happens during the fast is that your insulin levels go down. Perfect. That's exactly what we want. But so what we're doing is we're burning off all that sugar and getting it out of the system, right? As opposed to just getting it out of the blood, we're actually getting it out of the entire body. So the fasting does both things. It lowers the insulin and it lowers the sugars. The other thing that always comes up with fasting is it harmful? And this is what always comes up. Am I going to go into starvation mode? And what's interesting when you look at fasting is that studies of fasting show the exact opposite. You don't have less energy, you have more energy. So there are certain things that get activated when you're fasting. So growth hormone goes up, for instance, to preserve lean muscle. Then you'd start burning just fat. Adrenaline goes up to give you more energy. And you're fueling all that energy with fat because you can measure free fatty acids in the blood and they go up. So what's happening is that you're burning fat, you're preserving your muscle, and you've got plenty of energy. Perfect. That is like the perfect treatment. As you burn off the sugar, you're going to take off the medications and you're going to get better. And the thing is that people can do it, right? You just need to support them through it because.
So do you? I mean, you're practicing nephrologist. You see diabetic patients all the time. Do you tell them to fast, or do you help them to do that? Is it?
I help them to do that. We have a clinic that we put them in because a lot of them are on medications, and you can't simply do it by yourself. Because if you're taking a certain dose of insulin and you don't eat, if you take that same dose of insulin, you will go very low in your sugars and you could die. It's very dangerous if you're on diabetic medications. There are other medications such as aspirin and iron and metformin that can give you a lot of upset stomach too. So we take care of that for them. We monitor them, we tell them what to expect, and we support them through it. A lot of people, the other thing that people are always worried about is, am I going to be hungry? Am I going to be able to actually do this, right? And that's where they need the support. So we do things like group sessions where we have, where people can provide this kind of peer-to-peer support, right? So I'll have 4 patients in a room and we'll be talking, and one person will talk to the other and start discussing something like, oh, this is what I do during my fasting period, and they'll start to talk and they'll be able to give each other support because
what kind of fasting periods are we talking about? I mean, you can fast for like a few hours, a few days, a few weeks. What are we talking
it's really flexible because the thing about fasting is that it's really infinitely flexible. So you could fast, say, every day for 16 hours, and there are diets that do that. You could fast for 24 hours, which is, for instance, if you go from, you eat dinner, then you skip breakfast, skip lunch, and then you eat dinner again. So that's a 24-hour fasting period, and really anybody should be able to do that. So if you look at Michael Mosley, who's the author of the 5-2 diet, that's the sort of regimen that he proposes, and he's had tremendous success. There are lots of people who are doing it. It's basically 2 24-hour fasting periods twice a day. There's another book called Eat, Stop, Eat by Brad Pilon, and he also recommends something similar, 2 24-hour fasting periods in a week. You could do so, and I think for people.
What do you recommend for your patients?
Oh, we individualize it. So there are patients so most diabetics, we will have them do at least 36 hours, which is fasting the whole day. So you eat dinner, then you'll skip breakfast, lunch, dinner, and then you'll go to until breakfast. So that's actually more than 24 hours.
So what kind of feedback do you get from people who try that? Is it what's hard about it?
Well, the first time you tell them, their eyes kind of bug out and they say, oh, I can't do that. But then once they start doing it, they realize that it's actually not that difficult. For people who have very severe diabetes, who are on a lot of insulin, we'll actually tell them, we're planning to have you fast for a week or 2.
Really?
You'll come back in a week,
Wow.
we'll monitor you, and if you're doing fine, we'll take you another week. Because the thing is this, if you
Can
have...
they do that?
Oh yeah, they actually do fine. In fact, a lot of them feel terrific while they're doing it. This is the thing that surprises people. They come back and they think, I thought I'd be miserable during this whole thing. And they come back and they say, I feel terrific. My weight is down, I'm taking so much less insulin, I'm off of a lot of drugs, and I have so much energy, and my mind is more clear, I've lost that bloated feeling. And that's the real thing that's important to understand, is that it's something you can do. But the problem is that what's lacking now, when everybody used to do it, for instance, when people did, say, if you're Greek Orthodox, you have certain prescribed fasting periods. Well, you have that peer-to-peer support, because everybody in your community is doing it. The problem now is that people don't know how to fast. So we need to provide that. We need to provide that kind of support system that we can say, there are problems that come up. People get headaches, for instance. People get leg cramps. People get, what's the other thing, constipation. They're very common. And we'll tell them, we'll give them handouts, and we'll say, this is what you can do. And so we can help them through that process.
How can you stop that sort of side effects?
Well, we warn them, and we have handouts. So for instance, something like leg cramps, we'll tell them Epsom salts, for instance. Epsom salt baths are very good. They're actually magnesium chloride, so you're actually getting the magnesium into your system. You're absorbing it through the skin, and it helps a lot. You can take magnesium supplements. You can take mineral water. That helps a lot with the stomach growling, for instance. The headaches, it's a matter of staying hydrated, taking enough salt. And we tell people to take a lot of sea salt, which is strange because everybody is supposed to be low salt, low salt, low salt. But while you're fasting, you need to make sure that you're well hydrated because your sodium intake is going to be so low. Especially if you're only going to be drinking water and green tea or black coffee, for instance, you're not getting any salt.
To wrap it up, if someone is watching and they have type 2 diabetes or they have obesity, that kind of problem, what would be your top 3 tips?
I think cutting the sugars and doing a low-carb, high-fat approach is one of the very, very good things you can do. Obviously, it's not all carbohydrates that are bad. I'm not saying don't eat broccoli, for instance, right? Don't eat kale or something. But don't eat...
Just the bad carbs.
Yes, the bad carbs, the refined carbs.
Sources of refined, like
exactly.
bread and pasta perhaps.
Yeah, the sugar is obviously the first thing that needs to go. And it needs to be severely restricted, the sugars. The other refined carbohydrates also need to be, because again, that fits into what we're talking about, which is you got to get the sugar down, you got to get the insulin down. So cutting the sugar is really by far and away the #1 goal. Cutting out the carbs, adding more healthy fats. In our clinic, we call them natural fats because people think, well, it's fat, so I'll have some canola oil or corn oil. No. Those are refined fats, right? Corn is not a fatty vegetable.
So butter, is it good?
What's that?
Is butter good?
Butter is good. Olive oil is good. Avocados are good. Nuts are good. And the funny part about this whole thing is that it's not even, it's already well established, like nuts, for instance. You can look at studies and there's a clear association between nut consumption and better health, right? Nuts are very high in fat. So it's not the fats that were bad, but the refined fats and the refined anything, the refined grains, the refined carbs, the refined meats, the refined fats. So you can see these there's a lot of studies on processed red meat, and it's not that good.
So get rid of the sugar, refined carbs, and add in some fat. Is that your
natural fats.
Advice?
So fats are the fats that you find in nature.
Fats,
So saturated fat,
and
definitely.
If that doesn't do everything you need, then maybe some intermittent fasting.
Yeah, that's a more intensive sort of a regimen.
So if someone, you mentioned earlier that this could be problematic for people on medications like insulin. They have to take the doses way down, and they might need medical assistance doing that. If they want to learn more about this, do you have a website or somewhere?
Oh yeah, so it's www.intensivedietarymanagement.com. We've actually set up an entire program for people called the long distance program because we were getting emails from all over the world and saying, oh, do you have a clinic down here in New Zealand? Do you have a clinic here in the UK? And I said,
You're in Canada.
So I'm in Canada, yeah.
Toronto.
So what we thought about it, I thought, well, there's no reason we can't help these people. Now, obviously, we can't give medical advice. We're not there. We're not monitoring their blood, but they can go to their physician and do that, and we can give them the dietary advice. So you can join the program, and we can tell you, well, we think you should. We can go over your food diaries. We can talk to you about the low-carb diets. We can even introduce some periods of fasting, intermittent fasting, or even longer periods of fasting. But they would have to go to their own doctor to monitor their blood sugars, their blood work, and their medications. But we're simply giving dietary advice. If they take the same dose...
So they need some medical supervision, perhaps.
They need the medical supervision.
Unless they know exactly what they're doing.
Right. So we actually put a wall there so that people can't get the fasting stuff. And we get this question all the time. Why don't you put your regimen up? Well, there's no regimen. Everybody's different. You have to work with people, see what they can do, see what they want to do, see if they can do it. Because these things do have, if you're on medication, if you're on insulin particularly, you can get very sick very fast, right? You fast for a day and you take the same dose of insulin, you could actually go severely hypoglycemic and have a seizure, or you could die. So these are things that do need to be monitored. If you're not on medication, then clearly it's that the risk is much lower. But again,
like you said, in religious, people have been fasting forever. Right.
And the funny part actually is that if you look at Muslims and so on, when they develop their diabetes, they're actually the doctors tell them to stop fasting so that they can take their medications, right? That's the exact wrong idea.
Yeah,
they should actually fast.
Another example of what's totally upside down, right?
Yeah, but that's our teaching. We've been taught that, right? So I have. It's not that I think anybody's malicious. It's not a giant conspiracy. It's just that we've got our blinders on, and we've got this idea that's all about the blood sugar, and yet the disease continues to get worse. So then we say it's normal for that disease to get worse, but it's not. No. It's a reversible disease.
Yeah.
Right? And it affects so many people, right? And it boggles the mind that we can actually cure this entire disease without drugs. In fact, we're taking away the drugs, without surgery, and practically without cost. In fact, we'll save them money because you're not going to be eating, right? So you're going to save a bit of money because you're not eating all those meals that are there, right? So that's crazy.
It's even good for the environment, right?
Exactly.
Eating less.
Good for all of it. It's
good for everything.
Good for everything.